feel like a woman, right? You thought she was going to talk about all these drugs and all these sad things. But I'm here to make you feel wonderful about being who you are. And I want you to know that in medicine, the new age of physicians is going to embrace women differently than it embraces men, because we know we are the superior race, right? Right? That they wouldn't be here without us. We are the mothers, we are the wombs, we're the creators. And so this is it. This is a value that you have to think about. And we're going to talk about a lot of things tonight in a short period of time, but I want you to remember those things. And, as I go through my life, and I'm going to tell you just my brief story, but one of the things that, some of us that are older might look back and we'd say, what would I say to myself 10 years ago or 15 years ago? And what I would have said to myself back then are these words. And I think this is going to resonate with a lot of you. What would I tell myself 10 years ago? I would say, Tiffany, slow down. You don't have to work so hard. I'd say, Tiffany, you're doing a great job as you are. And I would say, Tiffany, everything is going to be okay. So sisters, ladies out here tonight, we don't have to take on the entire world. The men do have some role to play in the world, but what we need to do is we need to take care and appreciate ourselves. We need to understand what's going on in our body, okay? So why am I here to talk with you? Most physicians don't get up on a stage and do this, right? But I want to tell you about my journey. So when I was 15, my hormone journey started because I started having very irregular periods. And the younger people here might remember that time. And so what happened, I went to the doctor. The doctor put me on the birth control pill for a couple of months to help me get my periods regulated. They never did get regulated for a number of years, but that was my first encounter with hormones. Then, after I graduated as a doctor, I was on birth control, I was married, and then, not that you need to be married to be on birth control, but I was starting to have very bad migraine headaches. And I had seen my doctor as a resident, and I had talked to her about these migraines, and never once did she mention, maybe it's the birth control pill. So when I was a new doctor, I was working in Miramichi at the emergency room. I was reading about this, and I'm like, I'm gonna stop this birth control pill. And guess what? My migraines got a lot better after stopping the pill. And then, just over 10 years ago, so these were changes happening in my body that I didn't know what it was. I was getting palpitations, I was feeling these sweats at nighttime, and I was so stressed out. I was cranky, I couldn't make good decisions. Of course, with night sweats, and I was only 41, I thought, well, I've got cancer, there's something wrong with me. And then I started to kind of change my life and said, okay, what's going on here? At the time, I thought I was burnt out because I had switched countries. I was living in Northern Ontario. But now when I look back, that was perimenopause when I was 41. And me, as a doctor, I didn't even recognize it. And then a few years later, I was working in the emergency room, but I always knew that we need to understand what's going on at the bottom of illness. So we can put lots of Band-Aids, and some of you might have watched my Facebook, is this a Band-Aid or a solution? But we really need to get to the root cause and understand what's happening. So I started studying what's called functional medicine. And in functional medicine, I learned so much more about hormones that I had never learned in medical school. And so then time went on and I began prescribing hormonal therapy, but I was going through my own journey. We're all here on our own experience. And so 2 years ago, I had a large cyst on my ovary that was growing, and I needed to get it taken out because there were some irregularities in it. I got the cyst taken out, everything was fine, but they asked me, do you want us to just take everything? And I said, no, I want to keep my uterus, I want to keep my other ovary if it looks fine. But what was interesting, they took my tubes, because again, I wasn't aware that a lot of ovarian cancer happens in the tubes, not just in the ovaries. And they also found out I had endometriosis. And that explains so many things in my life. My painful periods, my difficulty with my bowels. And I'm like, this was just a few years ago. And it was all these steps that led me to truly understanding women's health more and more. And of course, I've got family, my sister, my mom, my nieces, and I want to understand the most I can with hormonal health to help them, and then of course to help all of you. And one of the things that I tell my patients is that when I get new information, I will tell you, because what's important to you is really important to me. And so this is how I've shaped my path and why I'm here with you all tonight. So we're here. So now I'm 53. I'm on HRT. I'm on hormonal or menopausal replacement therapy, and I feel great. I'm still on a journey, and I'm still on a path. I'm learning. My body is still changing. I'm sure some of you know that the shape you were 10 years ago is not the shape you are now, but I'm embracing that. I'm starting to see the wrinkles. That's okay, because that's a sign of my age and my wisdom. And I want you to think about that too, is that as we go through these changes, God didn't do this to punish us. This is a natural phase of life. We need to embrace it, but we need to make the lifestyle changes so that we have the minimal amount of symptoms as we go through. So again, the wisdom and wonder of this amazing female body. So isn't it pretty cool? We make babies, we bleed once a month and don't die. We can multitask, the telephone, the baby, the washing machine, and we keep the world going. So this is it. We're here to a little bit learn more about why you are wonderful and how to make you more wonderful the way that you are. So one of our phrases we use at the clinic a lot, Maxine and I, is that knowledge is power, right? And so this is one of the things I want to start with here this evening. So you were all given a handout, and this is this is going to be like my little cheat sheet of hormonal health. So I want you first to look at the top right-hand corner, and the little diagram says ovarian hormones through the lifespan. So this is a diagram from Dr. Jerry Lynn Pryor, and Jerry Lynn is a gynecologist in British Columbia, and she specializes in women's health and understanding hormones. And I love this diagram, and I just want you to see on the far left-hand side, we have childhood and our teenage years, and there's two lines on this little graph. So the blue line is your progesterone. So progesterone is a hormone we'll speak about shortly. It really helps us with making babies and keeping our uterus strong. And then the red line is estrogen. So if you look at both ends of that little graph, you can see in the beginning, it's kind of bumpy. There's not too many teenagers that have their period and then they're 28 days straight from then on, right? And so then the same thing happens as we exit our menstruating years. And we go through these times where we have irregular periods, heavy periods coming every 1 month, every 6 months, every 3 months. And so this is this menopause transition and the fluctuation of the hormones through our life cycle. And what you'll also see in the graph is that the red line stays quite high for a while as we get ready to go through menopause. But the blue line comes down more quickly, and that's the progesterone. It's our feel-good hormone. So these are the hormones that we have, our two major female hormones, estradiol and progesterone. So this is the key to understanding what's going on in your body is understanding the roles that these hormones have. So let's look just a little bit down below, and we'll talk about the menstrual cycle. Now, I was just speaking with one of our teachers here tonight, and he was saying how reproductive health has really been taken, it's an optional thing in the curriculum. So why is it that we have to learn about calculus and history, but yet we don't learn about our own reproductive cycles? So in particular for the younger people that I'm seeing here tonight, what you need to understand is through the month, you're going to go through hormonal changes. So if you look at this little graph, I won't go into the details, but on the far left, we have the menstrual cycle. And the red line at the bottom is the lining of your uterus. Because what happens, we bleed, and then our uterus builds up. It's getting ready to make a baby. If it doesn't get, if we don't get a sperm and an egg to come together, then we have a period, right? But during that time, there's some major things happening. So we have our two hormones again that are starting to fluctuate. So look at the red hormone. This is estrogen. Estrogen goes in two waves throughout our cycle. And you can see this in the diagram. So it has two states. Whereas progesterone, you'll see this with the blue line, it only peaks in the second half of our cycle. So why is this important? Has anyone ever had PMS? Did anyone ever wonder why? I still remember this. Like, I cannot focus, I cannot get things done, I am a bitch, and then it's like, the period comes and it's like, I'm happy again, I can get things done, right? Because our hormones fluctuate. So when we begin to understand this, like I remember thinking, this is not that long ago, like within the past 10 years, it's like, it's gotta be me. Why can't I focus? What's wrong with me? Why is my mind not straight? Why is my mind not clear? Well, it's my hormones that were fluctuating. And especially the progesterone in that second half of our cycle, the last 14 days, it really makes a huge impact on us. And one of the key things that impacts progesterone is cortisol, or stress. And who doesn't have stress? Let me see. Is there any hands? No. We all have stress. But depending on the degree of stress we have, it can lower our progesterone. So a lot of this might seem like, wow, what are these drugs or chemicals she's talking about? But this is within you, and this is happening. So if your progesterone goes down, you're going to have more symptoms as you get closer to having your period. One of the things that I found out early on when I was having pain in my periods, and this is before I really understood endometriosis, or, I was still working as an emerge doc, but I remember I read once, if you don't eat red meat, and if you stop drinking alcohol before your period, it won't be as painful. I don't know if anyone's noticed that before. So I started doing that. I used to like my wine, okay? There's probably a few red wine drinkers here. But I said, I'm gonna go clean. I'm gonna eat clean before my period. I'm not gonna have red meat, and I'm not gonna have much sugar. And guess what? My periods got better. How is that possible? Because those things influence progesterone, they have an impact on stress, they have an impact on inflammation. So when I found out later that I had endometriosis, all of these things made sense. Because, number one, you need to know, it's not normal to have period cramps to the extent that you have to lay in bed or take a day off work. It's not normal to have period cramps when you wake up in the middle of the night because you're in so much pain. It's not normal to have bleeding so that you have to wear a pad and a tampon at the same time. That is not normal. It's not normal that you have to go out in public and not wear white jeans or white shorts because you're scared that you're leaking through. This is related to our menstrual cycle. And if those things are happening, this is not, it's a sign that our body is not in proper balance. So this is why many of us in the women's health field now, we call the menstrual cycle the 5th vital sign. So when I see people, I'll always ask them, do you smoke? Do you drink alcohol? If it's a woman, what are your periods like? And then I ask about poop, because poop is really important too, and that's a whole other presentation about the gut. But your menstrual cycle is really important. But what happens in medicine? What do we do when you go to the doctor? And this is what I used to do 15 years ago when a woman would come in. I'd say, oh, your periods are irregular? Here's a birth control pill. This is what we're taught. We're not taught to help a woman figure out why she's bleeding heavy. But this is what I want you to have a little glimpse of understanding tonight. It's important to understand that. Because if you have problems, if you're the younger crowd here this evening, if you have problems with your cycles and you just go on the birth control pill, you're just providing a Band-Aid solution. And what are some of the short-term things that might happen? When you go off that pill, you might have trouble getting pregnant. And this is why I believe, too, that we're seeing so much more infertility than we have for years and years, because girls are going on the pill much younger than they ever were before. I'm seeing 14, 15-year-olds that are on the birth control pill. And often it's not for sexual protection, it's just to regulate their cycles. There's no regulation to it, okay? It's covering it up, and we need to get to the bottom. So, is that new information? Yeah? Okay. So the menstrual cycle. Now, let's see, my paper's here. So let's go to our key hormones. So when we talk about health, I've been talking about our cycle and this estrogen and progesterone. So what do they actually do in our bodies? Because some of you are going into, you've gone through your cycles, you're getting a little bit further on, and the cycles are becoming irregular. So maybe you're getting close to menopause or what's called perimenopause. So what is this thing that we talk about anyway? So menopause is defined as 12 months after your last menstrual period. Okay? And a lot of you probably think, well, I shouldn't have to worry until menopause. But guess what? The major changes go on in the 10 years leading up to menopause. And we call that perimenopause. And for most women, that starts anytime from their 40s forward. So for me, I was 41, having night sweats, hot flashes, and irritability. Some women now, even in their late 30s, can have those symptoms. So you don't have to wait till your periods are done to start to be thinking that the hormones may be having an impact on your health. So what do these hormones do? So estrogen. So estrogen is an amazing hormone. Number one, these hormones are not just sex hormones. They're not about just making babies. And I think that's what we've been told, and even in medical school, we're kind of taught that it's just about having babies and then we don't have to think about it. But now we know estradiol is so important for our body. It's important for our energy balance, for inflammation, for regulating insulin, blood sugar. It's a powerful hormone. As of last month, there was an amazing paper that was released that saw estrogen receptors in the brain. We know that estrogen impacts our sleep. It impacts our irritability, our hot flashes, but also our memory. Something to think about, memory. So then we have progesterone. So progesterone is the feel-good hormone. So for those that had babies, you know, a lot of you might have had that motherly glow and you felt so good. You're like, I'd like to have a baby again until it comes to childbirth, right? But it felt good to have to be pregnant because progesterone makes you feel good. So what happens? Like that little blue line, when it drops down, you're in your 40s. Oh, I don't feel so good anymore. I'm more cranky, I'm more irritable. Progesterone also has a role in sleep. So then we start to not sleep very well. Also, progesterone is really important for our joints and our muscles. So we start to get achy. So we're 45 years old, waking up with back pain, joint pains, frozen shoulder, whatever it might be, because that hormone is dropping in our body. And then we also have another amazing hormone called testosterone. This is not just for the men, ladies. We have it in our body, and also men have estrogen and progesterone. So we all have these hormones. They make us who we are as men and women. So women, as your testosterone starts to drop, because it's really a powerful marker, of course, for libido and sex drive, but it's much more than that. It's really important in controlling our mood, and it's also really important in controlling our energy balance. And of course, our muscle tone and our strength as well. So these are the changes that are going on, and these are the three key hormones that are impacting us. So what is happening in your body right now? So I gave everybody this, it's a menopause questionnaire sheet. So my thought was that you can start to look at this, and this is based on the journal of, it's called the Climacteric Journal, which is what they used to call going through menopause. And it's a scoring system that allows you to get an idea of where you're at, the symptoms that you're having. I like to do this now with all my patients because it gives a baseline and then it gives us something to follow up again in 3 months. So how many people had a lot of extremelies? Anybody have a lot of extremelies? When they were checking this off, number 3 on the system. So we see, so it's not at all, a little bit, quite a bit, or extremely, right? And so what you can do if you want, you can tally your score at the bottom. But one of the things I want you to look at are the different categories of symptoms. So we've got physical symptoms. And the first one here, I just need to tell this story. So who knows who Oprah Winfrey is? Or who doesn't know Oprah Winfrey? I don't know, there might be some teenagers. So Oprah went online last year. She was with Maria Shriver and Drew Barrymore. Did anyone watch this video? So Oprah Winfrey, multi-million-dollar woman, Oprah, she was having palpitations. She was having fluttering in her chest. She went to 3 different specialists, cardiologists. She had every test under the book because Oprah could afford it. And guess what? Someone at the end of all that testing said, Oprah, it might be your hormones. Oprah's like, no. She went on estradiol, she went on estrogel, and her palpitations went away. Why is this important? Because, number one, Oprah, she should have been able to find this out sooner, but it goes to show you that the level of knowledge and education when it comes to women's health is really not where it needs to be. She was at the best clinics in the world, and they didn't figure it out. I spent time in New York with a cardiologist. Not once did he talk about women's hormones when they were coming in with palpitations. So number one, doctors are not addressing it because they're not aware of the information. But also, why is it important? Because estrogen is really important for the heart. And you might not be aware of this, but the leading cause of death in women is not breast cancer, it's heart disease. Heart disease. And what's the best thing we need to think about when it comes to our heart is the role of estrogen and what it does in our heart. So the rest of these symptoms you'll go down through and you'll see, being tired, being dizzy, of course, pins and needles in the body, trouble breathing, urine symptoms, the psychological symptoms, you'll see feeling tense or nervous, not being able to remember things. Like the number of women that come in and they say, Doctor, I think you need to test me. I think I have Alzheimer's, or I'm scared I have early Alzheimer's. My mother has Alzheimer's. And then I say, no, it's okay. You are having some memory issues, but this is because of your hormones are changing. Feeling unhappy or depressed, crying spells, irritability, loss of interest in sex. And then, of course, the hot flashes and the sweats at nighttime. And these sweats, by the way, if you've never had them, soaking the sheets, changing your sheets at nighttime. Women, there might be some flushes here now, like needing a fan to cool off. These are not just symptoms that we have to deal with. Why? Because we know now, the more hot flashes you get, the higher your risk of heart disease. Right? Not for everybody. But why is that a problem? Isn't that funny? More hot flashes, more heart disease? Because it's related to estrogen. And as estrogen goes down, it's going to raise your risk for heart disease. And that's why women, traditionally, don't get heart attacks before 50. Women start getting heart attacks after they go through menopause because they lose these major miraculous hormones in the body. So this is your menopause questionnaire, okay? And then I want you to turn to the back side, and I just listed some women's health conditions. So in medicine, we need to change the way we teach, and I'm so happy now I'm working with residents, 2 females, which is wonderful, and then I have a male student. And they're both so keen to understand this because we need to change the way that doctors look at your health care. If they're not addressing your hormonal needs, then they're truly not addressing your health as a woman. Because your hormones will fluctuate, and we have to understand the way that drugs will interact and what conditions can be associated with women's hormones. So there's just a few I want to bring up because it's already 7:37. But the few ones I want to touch on. One is Alzheimer's disease. This is a woman's disease. 2 out of 3 cases of Alzheimer's are in women. 2 out of 3. Why is that? Well, we're trying to figure it out completely, but there's huge amounts of research being done right now, and with the last research that was just introduced, we know that estradiol is protective for the brain. So Dr. Lisa Mosconi is a neuroscientist. She works in New York. In the fall, she released a research paper that estradiol, so estrogen replacement, taken within the first 10 years of losing your cycles, reduces your risk of Alzheimer's disease by 60%. 60%. Isn't that something that it's good to know, right? So Alzheimer's. We already spoke about women's health conditions, of course, breast cancer. So you might be thinking, well, Dr. Keenan, they always told us that the hormones were going to cause breast cancer. Well, those studies were introduced back in 2002, and in 2006, 2007, the research came out that said, that wasn't really correct, what we told you. And that we know now, especially with a meta-analysis, this is when they looked at a whole survey of women, there were like 10 million women from America that were reviewed, that hormonal replacement can be protective against breast cancer. Because breast cancer is not caused by hormones. If it was, then why would any woman be getting breast cancer? Because the majority are not even on hormone replacement therapy, right? Breast cancer is caused by inflammation, and we'll talk about inflammation in a second. It's not caused by hormones. Hormones can help to protect. Fatty liver disease. I want to speak on this one. So some of you have it and you don't know it. Through the years of spending 20 years in the emergency room in Miramichi, I told many people they had fatty liver disease on their ultrasounds. I told them that they had prediabetes because they weren't really informed. And why weren't they informed? It's not because doctors didn't want to tell you. It's because doctors don't know what to do about it. But there's many, many things you can do about it. It's really important that you know if you have fatty liver disease. And guess what? It really is a disease of women too. And when does it happen? In the 10 years as you go toward menopause. Fatty liver disease goes up 3 times. Why is that? Estrogen drops. Estrogen's a master hormone. We're not processing sugar and fats in the same way. Fatty liver disease goes up. Diabetes and prediabetes go up. Guess what else goes up? Cholesterol. There's so many women I see. They're like, Dr. Keenan, I'm eating the same thing that I always ate, and the cholesterol goes up and up and up. And what does the doctor say? Well, here's a pill. Take this pill for your cholesterol. And it's like, that's the earliest warning sign that there's something going on with your hormones, okay? Other conditions, of course, insomnia. So, a lot of women come in, they say, I can't sleep, I never slept well. But I say, when did it start? Well, after my babies. But then when we get into it, it actually started, their late 30s or early 40s. That's the earliest sign. Some women think it's hot flashes, but for me, insomnia was one of those earliest signs. And when you might find it the most is those few days before your period that you just can't sleep. And that's the early signs of perimenopause and hormone changes. Osteoporosis, ladies, this is a game changer for me. And if there's one thing I've done different in my practice now, is I've started doing bone densities on women at 50 years old. The Canadian guidelines tell us that we shouldn't do a bone density to look at your strength of your bones until you're 65. Well, guess what? By then, it's a little bit too late. It's really hard to build up bone strength at 65. But when I have a conversation with women about their decision, whether they want to take hormonal replacement therapy, if they're on the fence because it's an individual decision, then I say, well, let's get a bone density. And the number of women that are already having thin bones or even full-blown osteoporosis at 50 years old amazes me. And one of the best ways to keep our bones strong is hormonal replacement therapy, along with weight-bearing exercise. So that's an important one. And then the other ones, we'll just talk about the vaginal things, because ladies, it's not normal, okay? It's not normal to have, are there men here? Boys, close your eyes in the back. But it's not normal to have sex and it feels like sandpaper inside. That's not good, because being sexual is part of our female body, and that's a sign that your estrogen is thinning out. And if it's thinning in your vagina, it's probably thinning in the rest of your body. It's not normal to have bladder infections and to be on antibiotics 3 or 4 times a year. That means things are thinning down below. So, and also as you get older, urinary incontinence. As you get older, what are the things that women suffer from? Urinary incontinence. And Dr. Kelly Casper, she's a urologist, she spoke about this, and she said, for the amount of money that we spend on Depends or bladder control products, we need to start talking to women very early on about their vaginal health and getting it better. This is not fun to have to run to the bathroom. Also, we know that vaginal symptoms or bladder infections land women in the hospital, and it can be a source of infection, and also osteoporosis. If you do get to the point that you have osteoporosis and you fall and break a hip, your chances of death are 50% in that year. So this is why we need to start the conversation early about menopause and about hormones and replacement, because these are the illnesses that we tend to have later on in life. So who's a typical woman that comes into the office, that comes to see me? So she's on usually at least 4 different pills, okay? So she's on Crestor for her cholesterol. She's often on Tecta for her stomach acid. And by the way, stomach acid is another symptom of going into perimenopause. She's on Imivane or Ativan for her sleep. She takes Celexa or Paxil for her anxiety. And then many women I see, they're on Cymbalta or gabapentin for their chronic pain. And I'm starting to see this more and more. Pain. It's not great to be in pain. And for me, I remember the year after I had my ovary taken out, because you're still producing a little bit of hormones even after you stop menopause. And I was on replacement, but I started having terrible pains in my back and all through my body because I had a further reduction of my hormones, and it wasn't fun to be in pain all the time. And again, these drugs, these Cymbalta, this gabapentin or naproxen, this is not solving your issue, and it's only going to get worse for many people as they go a little bit later in their lives, okay? Getting our vaccine, okay. So let's kind of go through. So how do you diagnose it? So number one, so if you're a young female, the big thing to look for is polycystic ovarian syndrome, okay? 1 in 10 women have PCOS. So if you have irregular periods, if you're gaining weight, or if you have a little bit extra hair growth, you need to ask your doctor to check you for PCOS. The next category is perimenopause. There's no blood test for perimenopause. There's none. But we do know that lifestyle influences perimenopause. So what can you test for? I listed here some of the things that I test for in my office. I want to know if you're pre-diabetic, if your sugar's up, and I want to know what your vitamin levels are like, because those are things that we can begin to control. And then as we get later, post-menopause, are there things that we check for? Yes, there are times that we measure estradiol and progesterone and testosterone because we want to see how your body's responding to treatment. But we still guide our treatment based on symptoms. So I wish I could say there's one blood test, and I wish I could say there's one drug and one blood test that's going to make you feel better, but it doesn't work that way. But hopefully as we do more research in women's health, that we're going to begin to understand where do we need to treat, who is the best, and that we have more medications to use for treatment. So that's our blood test. And so where does treatment begin? So treatment, in a nutshell, treatment starts with the basic pillars of health. And the basic pillars of health for me, you'll see it on this little diagram. There's 4 key pillars that I look at with women, and with men as well. But number 1 is the way we breathe. You might not be aware of this, but the way you breathe has a huge impact on the stress in your body. If you're not sleeping well, if you're mouth breathing, if you have sleep apnea, if you breathe through your mouth a lot, if you breathe shallow, it raises the stress in your body. And remember, when stress goes up, progesterone goes down. So changing your breathing can actually change the way that your stress is changed in your body. Changing the way you breathe can actually help you lose weight because of your stress response. Again, these are all lectures in themselves, but this is the overview. Food, of course. Food is a pillar of health. Food is not just energy. It's not energy. Food is medicine. I'm a nutritionist, but there was a time I didn't eat so good because I thought the box of cereal called Total that had all the total vitamins was enough, but it wasn't enough. We're given plants, we're given fruits and vegetables to nourish our body. So food is super important. Movement is super important. And ladies, both when you're young and as you go through the menopause transition, it is the time that you need to start working out. Why? So 2 things. 1 is you're losing your bone mass, and the best way to keep our bones strong is to do physical exercise. The other is you're going to start to lose your muscle. How many are getting the jiggles? I wish I had this. How many have, what do they call them? Wings or something? When I looked at this and I showed my nieces a few years ago, I was like, what is this? But as you age, it is normal when estrogen goes down that you're going to lose your muscle mass. And the only way to build it up is to do physical exercise. So the young ladies here, start it early, and if you're not exercising, you got to start doing it, okay? And it's not about weight loss. It's about body health, and it's about your mobility as you get older. And then the last is sleep. Okay, I know we're busy, we do lots of things, but the time of day you need to prioritize is getting your sleep at night. 7 to 8 hours, most people need that. So these are things you can do. You don't need a menopause or hormone doctor like me. You can start this anytime. And even if you go to your doctor, you can start these things on your own. Okay, there's lots of things now, YouTube and everywhere, where you can get information about this. And then, so what's the next level up? So we talk about lifestyle, then we talk about natural things. So there's lots of natural things that can help. When I first went into perimenopause, I took a supplement called Vitex, or chasteberry, and it helped my hormones, my periods. They were less painful, I was less stressed out. Promensol, Estrovera, there are things that are sold at the naturopath store that can help you, okay? And then the next step up would be hormonal replacement therapy. And again, I don't have time to get in all the specifics, but we'll have some time for questions. But we're talking about estrogen, estradiol, we're talking about progesterone, we're talking about testosterone. And there's lots of other ones that we could get into as well. The ones that I feel that are the best to use are the ones that are what are called body identical. So we have some drugs that are synthetic, well, they're all made, but some that look like chemicals in our body, and some that look very familiar to our body. So estrogel, okay, or the estrogen patch, chimera patch, Vivel, those look like what's in our body. And for progesterone, a lot of people might be on Prometrium, Utrogestin, those are some of the brand names that goes by. And if you need testosterone, we need to make that up a special way for women that need testosterone. So this is hormones and the women's life cycle in 45 minutes. How's that? But I want to finish with one article. There's so much we could talk about here. But many of you are saying, well, you're going to say, I went to my doctor and my doctor didn't want to prescribe me hormone therapy. Or I went to my doctor and they said, why are you on that? So this is the article from the Canadian Medical Association Journal. It was published in May of last year. It's called A Pragmatic Approach to the Management of Menopause. And I want to read you the key points. And if anybody wants a copy of this, if you email me, I'll send you this so you could read it yourself, or you could give it to your doctor, okay? It says, menopause symptoms can occur for as long as 10 years before the last period and are associated with substantial morbidity and negative impacts on your quality of life. They admitted it, right? Menopause hormone therapy is indicated as the first-line treatment. It's a safe treatment option for patients with no reasons, contraindications, you can't take it. There are other effective treatments, but they are less effective. Things like antidepressants and this sort of thing. And it is critical that clinicians, so doctors, inquire about symptoms during the menopause transition and discuss treatment options with their patients. I'm sorry that more doctors are not following these guidelines, but I'm here and, with other doctors in the province because we want you to understand that there's ways that you can improve your health, that you need to start asking more questions, and doctors eventually will be educated just like the residents that I'm educating now about hormones. So, thank you for your time. So hopefully you have some time for questions. Yes, Maxine? And like I said, this is a brief overview. We are I'm gonna do a Zoom next week, and it's gonna be Wednesday night at 7 o'clock, and I'm gonna try to answer a lot of your questions. If there's some that you didn't get to talk about here this evening, send me a message and I'll try to answer your questions. For those of you, some of you I've met in the clinic, but I am also setting up a private clinic focused on women's health and hormones, and I can send you more details on that as well. So, would we agree, just as we get ready to finish up this little thing? So what do you think or not? I know we talked about a lot of things, but at the end of the day, isn't it still good to feel like a woman? Yes! Okay.